It's 8:59, and you're never wrong, so we wanted to start.
Oh, 8:59. You know, way to go, run down to McDonald's.
Lots of time. Good morning.
Hey, Alan, I forgot to have you sign. Thanks for having. So. I don't know when else to see it here. Cheryl sign it.
Yeah.
Yeah, that would
Yeah,
happen.
that was the.
Yeah. And they're saving the better. So I'm glad I did it that way. So the original listing is May and it was out.
Okay, we're gonna call the public health committee meeting to order. And first off is. And the first item is a request for temporary increase to your building costs.
This is in order for us to, trying to get up and DEA certificates so that we can prescribe Sublocade, just a specific form of medications to treatment. Dr. Conlon, if you.
So there's a medication, Suboxone, which is used to treat opioid addiction. And it's a once daily medication that they take. It came out with an injectable form that lasts the entire month. And it's nice because for a lot of reasons. One, you can't sell them, so people that want to get on the injectable form are very serious about their recovery. And it works well, and it also is self-tapering. So if somebody decides they want to get off Suboxone, getting off Suboxone itself is challenging, and decrease the doses of withdrawal and all that. But the injectable kind of self-tapers, you just don't give it, and then over several months it kind of wears off slowly. So it helps actually people that ultimately want to get off of the Suboxone as well and do that. So it's become more and more available. And the insurance companies, it's expensive, of course, like anything else. And the insurance companies expect to cover it. And we're getting some funding to make it available. So we want to make it available both at the Spectrum location and at the jail setting. We are working together. So the one issue with it is that it has to be, I have what's called a DEA registration certificate, which allows me to prescribe controlled substances. And that is site specific. So the address of my DEA is at 400 North Main Street. And it allows me to prescribe pretty much anything, anywhere, and get it filled anywhere. This particular medication, for whatever reason, the DEA and the company and the FDA approved it, but in order to distribute it from a specific site, let's say we were to keep it at the jail, that specific site has to have its own DEA registration. So what I have to do is I have to apply for a second site and a third site actually at Spectrum under my name. So I'll have essentially 3 DEA registrations so that we can distribute that medication from those particular locations. So just jump through in order to get this program going. The cost for the DEA registration is about $800 each place. So that's why Kelly has the grant funding. We just have to figure out a way so we can go on the website of the DEA and pay for it. So we thought using a procurement card would be the most efficient way of doing this rather than trying to either have me pay and then reimburse me or I know there's mention of getting the DEA signed up and this, which would never happen. I think them at any sort of level as nearly possible. So anyways, that's kind of the short of it.
So that's why we're asking for that increase. We went for 1,800 just in case, you know, when we get in there. Any extra, but we have enough to cover it, so.
Okay, I have a motion by Supervisor Grant. Any further discussion on that? Hearing none, all in favor?
Aye.
All carried. While we're on that subject of that, I don't know if it's, there was a discussion on the section of community actions on this. There are negotiations for a methadone clinic up there.
The methadone clinic where
Community action.
is that, do they have interest in it or is there, are you asking?
There's in discussion with the Blue Water Ball.
Oh,
What about the known clinic on 28 by Airport?
okay. Yeah, I hadn't heard about that, but
I don't think very many people have. It was discussed at the last community action board meeting in open session, so I'm sharing it here. I don't think it's
I
any
think,
big deal, but
yeah, they were approached by Erie County Community Action because I believe they run several clinics in Erie County.
okay.
And so they were suggesting, I don't know if they get people from Wyoming County who go to those or why they reached out, but
Yeah, that's, I mean, the methadone programs are super highly regulated, unlike the Suboxone, which are regulated, but we can prescribe it in all settings. You know, methadone traditionally has to be prescribed at a specific site and has to be distributed at that site. It's given out on a daily basis. And as a prescriber, like right now, I couldn't prescribe methadone for addiction treatment because you have to go and you have to get a special certification from probably the federal government, I think. And in order to set up a clinic, it all has to be done formally through federal channels. So right now, Rochester has one, Buffalo has one, and Jacasa and Batavia opened one a couple of years ago. So I don't know, as far as demand for it, what that would look like. I'm not sure. And, we don't have that dense of a population that I think, again, it's hard to say. I really don't know. I don't know if you have any feel.
No, I mean, it's driven by slot capacity, and I mean, I could check with Casa to see how many people we have traveling from here to, to Genesee County to receive it. I do know that it's interesting of how that community action out of Erie County applied for a grant with Oasis to expand their sites. They received $200,000. The announcement said it was Genesee County that it was going into. Remember I mentioned that at our meeting?
Yes, yeah.
So I wondered, they must not have really maybe consulted with anybody, so now they're looking, because they have this funding to bring in another film. And it's not something they just pull off, but because you have to have Oasis approval and all that.
Yeah, it would be nice to, rather than kind of just doing something independently and popping it up there, kind of integrating it with the addiction and mental health services here in the community that we're all working with.
Right there at somewhere.
and,
yeah, again, they're only in discussion.
yeah, and
And the process, I think, probably would take, I don't know, probably a year or more, I would imagine, to do the thing if they were approved to it.
I think from what I recall, it was just that our local community actually would rent space out to them. They wouldn't be the ones running it.
Okay.
But yeah, I did wonder because, and that's probably why that they've got a distance between, you know, what we offer as services and what Rosemary had for information, because it was like, you know, there was no mention of negotiations with Oasis or certifications or anything. It was just, you know, here's the service so-and-so wants to do, we've got the space, it's a great fit. And it's like, okay,
Yeah.
I mean, it's very,
I think they were looking for space more than anything.
yeah,
On paper.
Yeah, and unfortunately, Laura can certainly attest to this on the public health side. We've seen, you know, this occur in many different programs where somebody from one of the cities just decided it's a great idea and pop something up without any sort of integration with what's going on locally. And I would hope that wouldn't be the case with this sort of thing.
It is concerning because there are mental hygiene laws that require them to have discussions with the LGU, you know, around planning and what the needs are with the community, and they haven't done that.
Yeah, and I think they would approach the community service
Yeah,
board.
they would need permission from community services board, although it is a frustration, I think, across the state because some places is notorious for kind of ignoring that piece, and they have done that, they have just talked down services to
Yeah.
communities that really without much, you know, input from the community, so. I think I want to get back to the audience. So, thank you for.
Jerry, is there anything on the, where planning and chamber used to be, is there anything in there now with the community action?
You're thinking of moving part of the cornerstone there. This came through.
This would be an area that they would look at, yeah.
This was, yeah, program.
Not that I'm aware of.
No, so I mean, they might also be looking to draw from Mount Morris and that area as well. That's a position on 28.
I don't know if LED has one either.
You know, it's not, they don't, not that I'm aware of.
People, it's a daily medication, so people continually to get their dosage.
Yeah.
For it, so.
Yeah, that's not really been an issue with it, especially in rural areas, if you go there, it's something to get it, you know, with transportation issues and all, so. I mean, I'm not philosophically, I would be supportive of it, but I think integrating it into the community program would be more logical. And then I mean, it ties into this, the jail issue, because we're now going to be required to provide services in a jail setting for addiction services and medications treatment, which includes methadone. So if an inmate comes in and already on methadone, we have to continue that for them. Fortunately, if they come from Jacasa, like I said, we can't, if somebody comes into the jails on methadone for addiction treatment, I can't prescribe it for them if I wanted to, it's not allowed to. Same in the nursing home setting, you can get a resident over there, that's methadone. So what Jacasa does is they actually will come and bring the medication out and manage the methadone piece of it in the local jail or let's say there's a facility that would come up. But we don't know about the other, you know, if somebody comes from Buffalo or Rochester, how we might think of that, or if somebody's going to get started on methadone in the jail setting, who's going to do that, these are all things we actually discuss this. We need to sort out, it's going to be, the state's going to, you know, be kind of correcting what we're supposed to be doing, so we'll wait for more information on that as well.
Sorry, bring it up. Okay, I approved it. Professional service contract.
So the Beaver Hollow Conference Center, it's our employer veterans program. I think they hired Brown, which is another veteran serving program, has been doing events at Beaver Hollow. That funding is ending, so Tony is working with them to continue that for the rest of the year. They're able to use the facility and do recreational activities that, you know, veterans sign up and go and spend a day on the weekend. So for $13,622. $662.
Okay, I have a motion by Supervisor Britt. Is there any further discussion? All in favor? Opposed? Carried. Appropriation 13,000.
Yeah, so, this is the reason. This is for, we received federal substance abuse prevention block grant funding. I know I told you guys about that previous months. We're finally appropriating it. The stabilization grant was for stabilizing the program or the facility. So we had put in for partnerships with prevention, a little bit of equipment, and then there was money to paint our walls at the office. So they did, Jim Rakowski did come in with his guys and Jim himself, but he hired people to come in and they did take down the wallpaper in our lobby and they did make it look nicer, they painted it. So, but this funding will be utilized to paint other areas of the office space. As done. So you're.
Or someone make a motion? I'll make a motion. Thank you, Doug. Supervisor Burley, makes a motion. All in favor? Aye. Opposed? Carried. The resolution.
Just also, Bethany Flares, our trail, our boat trail, the picnic that they do, we needed to amend it. They had the picnic and then some summer events that were happening and we didn't account for a minimum of 20 people. So the trail was concerned if it went over that number, contract would cover it. So we had to increase the amount.
Any further discussion on it?
That's probably what, I thought maybe it was because just the cost of food and everything. You know, when originally that's something that we're going to be seeing right along, I think.
A motion by Supervisor Britt, any further discussion? All in favor? Aye. Opposed? Anybody have anything for that? Okay. Thank you. Okay. Welcome.
Hello. Good morning, everyone.
First up is to amend the resolution.
Yeah, so as about a year in the COVID response, the county, through the health department, started benefiting from some grant funds from the state. Among those grant opportunities was the school grant, which was very welcome, and we accepted the funds and then subcontracted out with the school districts to provide them financial assistance to meet the demands of COVID response. So New York State has made the decision to extend this grant for another year, hence the amendment. And I just want to say for a moment, we have some unexpended funds in that grant that we're talking internally how best to use. And on a conference call recently, Wyoming got a shout out for being one of the few counties in New York State that was legal and effective with this grant. A lot of the other counties have just not been able to make it work. And so I appreciate the partnership between the health department and the staff and the school districts. They've been good partners. There'll be likely, as this takes shape with a year extension, some additional requests that are brought before the committee, potentially to amend Schedule G, some stipends that are awarded internally, and to potentially increase the amount of subcontracts to some of the school districts that we have. But they're all focused on year end right now, and of course it's difficult with COVID to know what's going to happen next week down the line. So this one may come up again, but this was a good first step. We got the paperwork and
Questions on that? No. And motion by Supervisor Grant. Further discussion, all in favor?
Aye.
Opposed? Carried. Amend salary schedule passed.
So earlier this year, when the county undertook considerations to provide 2021 lump sum and the 2022 COLA. When those lists were published and they were developed between the clerk's office and HR, we had 3 that were missing, and so I sent out an email prompting review of them. 2 of them were taken care of. This one, and part of it is related to my absence for a period of time. And so this is an item that requires board action. Joss has been wonderful as our fiscal administrator, exceeding expectations. And has been an employee of the county since 2014, continuing to accept positions of additional responsibility, and is currently not in the department. So as a COLA consideration, I'm advocating for it, but it's a discussion at this point.
I move.
If there's no discussion on this item.
I just,
motion by-
Jerry, or Supervisor, I think we should get in the habit of doing all these once a year at our, compensatory board or whatever we use.
I gotta tell you what happened, because when I sat down with, Dan Farberman,
I know people were missed, I
Well, there
understand.
were a handful of them that we had highlighted because we had questions, okay? And then the questions never got answered. So in my mind, and the questions they went like this, and I don't know exactly what the question was for Jess, but it was either that we didn't know who the person was, so we couldn't look them up in ACS. Or we weren't sure what the department had in mind because we didn't look them up in ACS because we didn't know who the person was. So once we knew it was Jess, in my mind, this is just housekeeping. And that's all not.
Okay, but I just feel like we're piecemealing all these people since we did this contract,
And so I would
and
agree
it's
with that.
not,
In the health system side with that hat on, I would agree with that, and it's uncomfortable to keep going back and touching these when the intent was set a long time ago. In this case, I feel pretty strongly the initiating email answering these questions happened in February. I thought it was taken care of, and it wasn't until just recently I signed on paper that I realized it was not. So I understand the considerations.
Do we know if there's any other ones still floating around?
There shouldn't be, but it was clearly an oversight.
maybe going forward, we need to
And
be
that's all
more
I'm
careful.
comfortable saying in an open session, so if you want to know more, you can come and see me, I would say you want an open session.
Okay.
Headed up in the deputy position, he was not union before, and then he was salary, and there was a negotiation to get all that figured out.
Right.
It's probably similar.
It is, because Jess stepped into this as administrator in 2021, previously having been a fiscal officer in the health department. So there was that piece of the equation as well. I understand your concern.
Any other questions, comments? Motion by Supervisor Brick. All in favor?
Aye.
Opposed? Motion carries. Walker.
There's 2 of them. So the world is opening back up again. We've recently seen New York State Department of Health just really stepping up their training on non-COVID programs that certainly have occupied the attention of the department, every one of us in the last couple of years. And so these 2 trainings, one is the annual Weights and Measures Conference. Ryan Hamilton has been receiving training in order to do weights and measures inspections in the community. He'll be representing the department. This is a week-long conference, which is a lot of weights and measures in the summer season. After looking at the agenda, there are 2 particular days that Ryan would benefit from attending, so that's what this request is. And the second one is was worked on in conjunction with emergency services. So we've recently onboarded drones as part of our inspection and community response process. This is actually like training. We have 2 certified drone operators. That's what I thought. So there are 3 certified drone operators. This training, because we only have 2 devices, is really sensible for 2 people since it's hands-on. And so this will be Rob and David. flight off.
Do you have the room with you?
No. I know it's interesting, this is the Department of Homeland Security is funding this.
Yeah, so-
And paying for our rooms and the training, which is nice. So, thank you, Brian Myers, for bringing this to our attention. Okay, I have a motion. Thank you. And a motion by Supervisor Roberts. For any further discussion on items 3 or 4? All in favor?
I,
Opposed? Carried. Got a couple FYIs.
Do. The first one is County Saver ad insert for the Navigator program. And the second one is Lamar billboard for the Navigator program. Now that's health insurance enrollment services for the marketplace in New York. The health insurance had this contract for a while, it was year 3 of 5. We ended up with some unexpended funds. We had gotten permission from the Navigator grant to do some security enhancements at the health department. However, workflow has not really given us the ability to get that done. It is a joint effort between Buildings and Grounds, IT, and the health department, and the grant ends at the end of July, and we are just not going to have time to get that done. So these funds, we are hoping the program will give us permission to reallocate them to outreach and promotion for the program. That's correct.
Operational.
COVID response. There's a lot of illness in the community. Our rate, although the CDC thresholds give us high transmission designation, I think it only tells part of the story. I think there's just a lot of illness in the community. I think a good portion of it is COVID cases. People, I think, are taking home tests that perhaps turn positive, perhaps do not, and may or may not be reporting them. So, the advice now coming out of the health department is largely to reminding people that if you feel sick, stay home and don't expose yourself to adults or children that may be particularly vulnerable. So, as a side note, and this is supposed to be a milder variant. Yeah, I had it Easter week, not so much. So, pay attention to how you feel. It is, not something to think about.
On the hospital side, we continue to see not so much the novel COVID, but we are getting sick. People have got some issues over there now that are either directly or COVID related. Again, most of the people that are with lots of other illnesses and medical problems, that's much that the sick don't ever see that. So it's continuing. It's not in the spotlight now, but it's definitely still causing some problems. And I think the bigger issue continues to be staffing related to that, and nurses and staff getting in and out, and not having enough to our units and floors and everything else. So hopefully we'll settle down a little bit more.
I've noticed we're listening on the monitor to some of the rescue calls. It seems like they'll list like 4 or 5 different things that's wrong with an individual. And then at the end, it's and possible PUI.
Yes.
And it's like, there's a lot of things piling up on somebody. It's not good.
So having said that, ASIP, which is, I don't have the acronym,
Something organization
practice council, just approved COVID vaccine for 5 to 11-year-olds in a more robust, the whole series, correct? And so we're looking forward on that to potentially partnering with some of the family practices that have a good-sized pediatric population, see if the schools may have interest in, like in August, closer to school resuming. One of the things that came up, we've got some COVID dollars internal to the department that remain unspent, was to bring before this committee and ask for your opinion on incentives for people who are unvaccinated. We have as a department resisted this, right? Right along, but now we've got people potentially considering COVID vaccination who perhaps their original objection was it's too new, and now it's been around for a while. So we batted this around at the table at the admin meeting a little bit, and I wanted to get some, and honestly, I'm thinking probably gas cards are way to go these days. I didn't want to make a decision on proceeding with them until I talked to this committee decision.
So you want to reward the people for getting the vaccination?
Yes, so this is something that's been in practice elsewhere, both at the statewide large vaccination sites and other community-based organizations, and local health departments used incentives to get, people incented to be vaccinated. In our county, we found that those that were particularly interested in being vaccinated didn't really require any incentive, but now we're relooking at it because the landscape has changed somewhat, and I didn't want to take that step and execute as a department.
Are we over 50%?
Yes, yes. 50% with at least one dose. I didn't look at that supervisor for the meeting. It's 58.7, I think, something.
Closer to 60. Yeah, we talked about this a year ago, really. Yeah, we didn't think it was right to be paying people to get vaccinated essentially. But like Laura said, the tide shifted a bit, there's money sitting there, and it's trying to get it done. A little bit of everything, be on the fence and want to get vaccinated. So I don't think we're still 100% comfortable with the idea, just from a philosophical standpoint, but again, it's not here in Charlotte, a lot of other places doing it all along. So I don't know if there's a lot of downside to it at this point. The downside to it before was that, you had a bunch of people that were there before they got vaccinated, and then all of a sudden find out they could have got an incentive, they waited, they got vaccinated. Now, nobody's really vaccinated at this point, so the ones that have been forward is not going to create any bad feelings for those that we did.
Has this been successful in other areas? Don't you know?
Well, so no, that's a good question. That's one, how do you, unless you're asking very specific questions on an exit survey, how do you determine if the incentive was actually the reason that somebody came and got vaccinated? So among those vaccinating agencies that have offered incentives, I'm sure the answer would be yes. What do I know for certain? I don't.
And I haven't seen, I'm sure when they do get around to doing some studies on this stuff, I'm sure they're going to be taking a look at incentives for vaccination versus not, vaccination rates and the effect on the population. I didn't see anything like that come up at this point. So yeah, so we really don't know. I mean, certainly on a smaller local level, I think maybe I helped a little bit, but I don't know from an overall perspective.
There are at least a handful of students that are going to get a free ride at a SUNY school with incentives. We're not thinking of anything like that. We're thinking like,
Be surprised if you came to a lot of people, because I know people that got vaccinated and they're just dead against it, That's not going to entice them,
Right.
It would be interesting to see, as I just said, I think the ones that aren't vaccinated at this point are the ones that are really, really object to it. For a number of reasons, and I don't think this is going to be enough to.
So I'll chime in on that though. We've recently onboarded some employees to the health department, and because we're an Article 28 facility, vaccination is required. And at least two of those individuals were not vaccinated when we undertook the original conversations during the interview process, and both of them were like, yeah, I just didn't get around to it. And so, I think there's some middle ground that is untapped, and I think, potentially some focused clinics on the pediatric population might yield some movement there. And I think,
I think some of the 20, 30-year-olds probably do take the time to get vaccinated. Even vaccinated.
What other uses what might you have for the funds?
Yeah, so there's a tricky question. Given that the dollars showed up a year into pandemic response, and there were a lot of dollars. And on each of the grant funding streams, the usage of those funds was pretty restricted. And so we're now down to what eligible expenses do we have remaining. Our staffing is stable right now. We don't particularly need any additional team members in the house. The vaccine is still being provided at no cost to local health departments. We're running out of grant acceptable ways.
We've been really creative to get some costs covered in any way that we can to bring it back. And even those creative things now are trying out.
Yeah, we even just worked really hard with the hospital to go ahead and get their screening computers purchased for them. So we would ask them to see if they need anything.
Some building renovations that have been on the back burner for quite a while. So some of those expenses that would normally be borne by the health department's funding streams or the county's capital budget are a portion of potentially being captured by PLC. But there are dollars left, and at least one of the grants closes the June 20 or March 23, and I think there's one more that is a year past that. We are really looking for opportunities to expend money in ways that are potentially further the goals of the grants.
Are the local pediatricians on board with vaccination? And maybe that's a question you don't have an answer to, because I think that's where parents are going to go.
So it is a question that I have the answer to. And the local pediatric practice has been hesitant to either recommend and direct or decline. I think the reasons were related to the newness of the vaccine and which is why we were seeking potentially to partner with school districts or communities or the family practices, is because the pediatric practice has just not been willing to. So I didn't know the answer, it wasn't what I wanted to get.
Thank you.
When you partner with the schools, you partner with Gilead schools in the area, they have quite a population of people that go there.
I don't think we have, but that's something that's at the table. We have 2 COVID response staff members, and we are trying to keep them proactive, boots on the ground, just to determine where in the community there might be opportunities.
I know there was a little discussion with them about gatherings at one point.
It did decline the school, we also had reached out to all the high schools as well, but we got that up and running.
That was almost a year ago now, so, it would certainly, a phone call is, or a visit isn't easy enough to make. Again, I think the schools are very focused on year end right now, so it may be even over the summer deliverable.
Is this just for the initial vaccine that they would get some kind of reward? What if they went back and got a booster? Because I need my booster, I might jump in on that.
I don't know how we were out there. I think of the stages, your initial booster.
We've not hashed through what it looks like, but I'm inclined to agree. It has testing and vaccination. So in response to your question, I think the only other expense that has come up that we're looking at is early in the response period, there's a vaccine type, it's Pfizer, that can be ultra cold stored, which is some silly temperature. I don't know. And those units, those freezer units were very difficult to come back early in the game. And so the supply of those has loosened somewhat. That may be something that we will take a look at. And then potentially, our fridge and freezer, our vaccine refrigerator and freezer, I've got some years on them now, and we've had Arctic out to do some repair and maintenance on them. That may be an opportunity as well. And we have some further renovations that we're hoping for in the health department once the space for veterans is. Although it's hard to justify to a grant a kitchen and break area. We talk about COVID well, then maybe.
It's a place for people with COVID to isolate. They need to eat.
That's true.
Health for low temperature, will they be utilized for other vaccines?
So at this juncture, I don't think so. It is the Pfizer that when you receive a direct ship, that's what it's for, but I'm not talking about a full-size unit, the ones that I've seen look like chest protectors, not to be confused with the rabies. Well, so what we've been doing right now is that ultra-low temperature freezer exists at United Memorial Medical Center. And I don't know what the current process is, but Genesee County ordered, health department orders it, they collect it from United Memorial in the deep freeze if necessary, and then they've been transferring doses over to us. So it does result in a lot of driving around. Once the vaccine comes out at ultra cold temperature, it's got to be used in a particular shelf life. So we are experiencing kind of high, they call it responsible wastage right now. Because if we crack a lab for someone who wants a dose, that's what we're doing every time. It may result in 2 used doses and 12 discarded. It's 14 now, right? You could say yes, because I didn't really know the answer to that.
I would say 12, but it's for me.
So we're back to the question on the gas card, so it's, we're not gonna go crazy with this. We're not-
How much of an incentive are you thinking to offer? $5 or $100?
Well, we're not gonna go very far, we're asked to the health department back. So probably, we didn't discuss this either, 20 or 25, maybe, just, we've got a lot.
I guess the gas cards would be fine, but I'd personally like to see if we need to update your refrigerator and freezer for the vaccines. I would rather, if we can go that route,
Okay, so.
that's my thought,
That's
because,
fair consideration, I think we've got so much money on.
And that's fine.
That there's an opportunity to do
I think they all of
those things. We've been pretty nimble in response, and the first year we used volunteers and we got it done, and then this money dropped in, that was a little thing to the game, if you will. Jess has done an exceptional job, creating expenditures and.
You can track everyone, so somebody will come in and get another dose because they're going to get a free gas card.
I can honestly say we have not run into anyone, like people come in all the time looking for new cards. And sometimes people come in looking for cards when they haven't actually been vaccinated, that's a thing.
Yeah, I know took a lot of money from your way.
We try to be, very practical with it, make sure the goals of the county are further. They're all really going to, no matter what department it's in. If it's acceptable, we will take some steps to set that landscape for fall, being sure to recognize what other expenses we have first and the available dollars. And it's okay, we'll go ahead and proceed with the plan. I think it'll result in us having to come back for an FYI or something. Thank you. Proposed a dual program minor. So every now and then we end up in a situation where our current minor has kind of aged out of the program. Either because they've practically aged out or just we try to make sure that we're utilizing generally a student to do these inspections along with the health department staff. So we have a new proposed minor, which I may pass the picture around. This is really just for your information. This would be Jessica's son. And this is something that we've handled previously. When we've had minors from outside the department, they're often so nervous during those inspections and the entire experience in the department that it's difficult for everybody involved. And so we previously used children of employees to get the work done. Not directly supervised, we would never send a parent and child out together to do the inspections, but the familiarity makes a difference in the effectiveness of the inspection. Let's picture I'm on the expert. He's very young.
Oh, and how old is he?
So,
7, okay.
And the role of, we generally hope that when a minor engages with the department for the 2-bit inspections, that we have them around for a while, because there is some training elements that has to take place. Confidentiality, all of those steps.
We're also looking at the fact that we need to do some inspections here in short order, so, getting a minor that's available is.
You send him out to buy cigarettes and stuff?
Accompanied by.
Didn't one of your children do that?
Kim Standish's daughter, Natalie, was our most recent. She is the knowledge child. So the fellows program, that's another newish grant that the state health department has provided to local health departments. And it was just over $500,000 for, we hope, at least a 2-year period. And Wyoming County received permission to hire 3 fellows. One of them is Joanna Cremile, over planning as our senior fellow, working on the GIS program. The second was Amy Joy doing population health. She's since left for another opportunity. And then I know there are a lot of very complicated considerations in front of EMS right now, so we were just able to recruit someone for a joint project with emergency services around EMS. And so Andrea Rinbeck joined the department last week, and she is actually seated at the health department because of space considerations. So she's working at Brian's direction. We're going to see what that volume looks like, and we have additional assignments on the back burner for her. So we do have one more position vacant, which we have a vacancy slip for, and we'll be looking for the right candidate on that. At this juncture, we're thinking it's accreditation, which has been a hot topic in New York State for 10-ish years now. And we've been a little resistant. Pre-pandemic, our capacity to undertake something that complicated and expensive was just not there. And we're staffed up a little bit right now. This fellows program may be a good opportunity for us to start taking those steps toward accreditation. New York State Department of Health has not yet said local health must be accredited. I had a feeling pandemic that it was going there, and most of the counties in the Western and Finger Lakes region are either already there or on the path. So we're taking a look at that. Maybe that the fellows program will, it's not a free undertaking, will help us with some of the expense, not only with a person to help lead the work, but also the accreditation. So we're working on it.
What does that mean? What does accreditation mean for the health department?
Yep, and so it's the Public Health Accreditation Board, and every health department in the United States, whether it's, so New York State is accredited, has to meet the same group of standards in the way that you conduct business, the way that you document meetings, the way that you undertake programs to make sure they are evidence-based and meeting performance measures. But it's much like a hospital is Joint Commission certified. It's that same body of standards applied to a local health department. And if you've seen one local health, you've seen one. We're all a little bit different. It's just trying to create some structure in the background for each of us. That's just FYI. So I think let's see. One of the last items, there is a grant application that has become available specifically for Wyoming County called the Healthy Families New York. We're working on developing a partnership with Community Action that is essentially to provide expanded in-home services for families prenatal to 2 years old for the child. And the goal is to improve outcomes for families that are on home assistance. We've been engaged with discussions with, I feel like, everybody on this. And Genesee was also invited to apply, and I tried to see if we could shake the bushes and get a joint application with Genesee and Wyoming, because I think that's a favorable approach that they don't want. So that's FYI also. And the last thing is regarding response among county employees. For a long time, when we've had a situation where there is a critical life or property event, we'll release staff that are firefighters to respond, right? With the understanding that the time that they're away from the office needs to be within reason made up in some way, either working through lunch, drawing on comp time, working late, whatever. And I just wanted to check in with this group. That's been our policy, to make sure that the county and the needs of the communities are supported. It is not extended to EMS calls just because volume is so high right now. I feel like we turn loose our first responders. So,
We're gonna meet tomorrow after public safety. Myself, Susie Bay, Bill Stryker.
so more to come on that. I just wanted to check in, the county just said,
The policy.
okay, that's a little bit of policy, okay? Very good.
Yeah, so. We need to address it. I know there was a lot of businesses years ago that released their people, but what happens later is created. Just letting people know when they gotta do. I think that probably, people on a two-day call.
Rob brought up a good question. What if the person who's driving a county vehicle?
Right. And the EMS call volume is so high right now, and I know it sometimes takes a couple of tones to get sweat out there. I don't know that we have the capacity. It would really impact workload. There would be things that were not getting done if there were EMS calls. And I like the idea that it really just had, it's got, I would like it to be pointed up to department supervisor before anything happens. So, if someone's sitting over in Holsville doing the work, that work is abandoned, and that's impacting homeowner contractor. I think there's a lot of moving parts there, so. I support it wholeheartedly, but also would be helpful. That's all I have, I talked a lot. Are there any questions? I don't know, good to see everyone.
Any questions for the
Okay, Rob, did you have anything to add on the environmental side?
So we're started. Started in ground inspections. Other residents will park things that we do better weather than us. Children stamps are very up, so we're working paperwork, but yeah, we're a lot going on.
Well, and to that end, thank you for reminding me, is since I've been here, some 20 years now, we had a student join us during the summer months to help with lower technical grade type things like going to water samples and things. We had no luck recruiting this year. So, Rob and I talked about it, whether or not we wanted to do a Hail Mary and try one more time, but at this juncture, by the time you get someone background checked, workplace health and oriented, it's July. And for college students, they're leaving 6 weeks later. So Rob has developed a plan for the department to meet, that need bucket. And we're gonna have to fall back and just really think about this position given the current labor market and how we may want to handle it.
Nothing? Anything else come before we go? No, we're good.
Okay.
Oh.